meeting of the Homelessness and Rough Sleeping Subcommittee. Please note that this meeting is being live streamed and the recording of the public section of the meeting shall be available on the City Corporation's website for up to 1 civic year. Chair.
Great, thank you, Town Clerk. I'm Mark Wheatley and it's my pleasure to welcome members of the committee, officers and those dialing in from outside to this subcommittee of the Homelessness and Rough Sleeping Subcommittee of the Community and Children's Services Committee. Quite a mouthful for an afternoon midweek. Right, Town Clerk, do we have apologies?
Thank you, Chair. So we are turning to item 1, which are apologies, and apologies for absence have been received from Shrajan Joshi, Steve Goodman and Sophia Mooney.
Marvellous, thank you. Item 2, declarations.
Thank you, Chair. So item 2 is declaration. So if any members, please, I'm going to ask if any members in the room have any declarations in respect to items on the agenda, please.
Thank you.
I'm sure it's okay, but I'm an associate with Homeless Link and I know Homeless Link are on the agenda today. So.
Marvellous, thank you very much.
Thank you. And turning to item 3, which are the minutes, and these are to agree.
Thank you, Town Clerk. What I'll do just for form is take them for accuracy page by page, and then again for any matters arising that aren't on the agenda. So members of the board, and we do have other members of the corporation attending today, but for members of the subcommittee rather, page 5 on accuracy.
So, I was at the meeting. I was online, but I was at the meeting. Didn't give my apologies.
Marvellous. Kate, could I just ask, Kate is clerking for us today only, so could you identify yourself when speaking, members of the subcommittee? Great.
So Patrick Fowler, I was at the last meeting. Thanks.
Thank you, Patrick. So page 5, accuracy, page 6, accuracy, 7, 8, 9, and 10. Any matters arising on page 5, 6, 7, 8, 9, 10. Marvellous, Town Clerk. Unless any member wishes to sort of challenge now, those minutes are approved. Marvellous.
Thank you, Chair. So we now turn to item 4, and this is the independent evaluation of City of London Rough Sleeping Services. And this is an information item starting on page 11. There's also a PowerPoint presentation that accompanying this item, which was circulated to members yesterday, and Helen Lewis is from Homeless Inc., who is joining us online as well.
Great. So thank you, Helen, for joining us, and you have the floor.
Thank you very much, everyone. Can you hear me? Can everybody hear me okay?
Yes, you're coming through.
Yes, great. And would you like me to share or try and share the presentation now, or can you all see the presentation and shall I just talk to it?
Whatever you feel most comfortable with, but I think
okay.
Sharing would be helpful if that
would be
works
helpful. Okay, let's hope it works. Yeah, thanks. Okay, can everybody see that okay?
No, but I think you might as well proceed if you're okay, Helen.
Oh, okay.
Thank you.
Sorry, that does happen sometimes. Sorry.
Oh, no. It's flashing up now.
Oh,
apologies for wrong footing you.
Got rid of it. Okay.
Marvellous, thank you.
Okay, so I'll have to start that again actually because I can't see that now. Sorry. Dear. I'm sorry, I've had to. No, I've lost it. Oh, here we are. Oh dear, I'm sorry. Now I can't seem to find it. I'm sorry. I'll try once more.
Yes. Please don't worry. We have paper copies, and anyone who wants to dial in.
Yeah, I'm sorry. For some reason, that's not showing up on my window now. Okay,
and Helen,
I'll just talk to it again.
I'm told that Will Norman can share from his laptop. Thank you.
Okay, right. Thank you. Thanks a lot, Will. Right. Sorry about that. So yes, I'm an associate. Thank you, Will. I've worked for Homelesslink for quite a long time as an associate, and Homelesslink was commissioned to do this piece of work by Will and colleagues, essentially of the rough sleeping services. And so we carried out the work between last December and July this year, so it took quite a while to complete. And what we were asked to do really was Will asked us to do a review based on a number of considerations. If we go to the next slide, please. Thank you, Will. So I've put those on here. So the main considerations were how well existing services and interventions are likely to meet near future demand for having successful outcomes for rough sleepers, how effectively current grant funding is being used, if rough sleeping work streams are well integrated with wider homelessness services, that includes statutory homelessness and supported accommodation pathways, how well current partnership arrangements are working, and if services that are commissioned to work or are working with rough sleepers are able to demonstrate their impact in reducing rough sleeping. So the work involved a sort of document review and data review. The data review was chain data relating to rough sleepers in City of London, and also a small group of comparator boroughs. Also, we looked at the rough sleeping annual snapshots and HCLIC data for City of London. We also spoke to a range of providers, including Thames Reach, St Mungo's and Turning Point, and also City of London officers, and other managers of commissioned services for rough sleepers in two other areas, two other boroughs, that's Lambeth and Westminster, for good practice comparison. And we also had an eye on the objectives and priorities in the current rough sleeping and homelessness strategy, so around rapid intervention and tailored interventions for rough sleepers, access to affordable accommodation, partnership working again, and support looking slightly beyond accommodation, so around recovery and employability and preventing repeat homelessness. Thanks, Will. So this is quite a short presentation, and what I have on this slide is some of the overall findings, and then having done that, if I'll go through each of those areas that I've just outlined there with some more detailed findings. So overall then, the review found that the current service offer in the City of London is comprehensive and likely to meet the needs of most rough sleepers in the future. And there are some services that the City of London manages and commissions which are thought to be particularly effective, particularly valued by stakeholders. So, for example, the assessment centre at Snow Hill Court, the offer that is there for people with no recourse to public funds, the specialist roles that the City commissions around homeless health and the social worker, and the PRS access scheme. We had very positive feedback around the City of London commissioners. The feedback included a feeling of sort of consideration that the commissioners are highly knowledgeable, committed to partnership working and co-production approaches, and being open to innovation to meet emerging needs and to tackle any barriers there are for rough sleepers to engaging with services. We found, because we talked to other boroughs, and we also took a sort of a brief look at the policy environment, if you like, across London and nationally, we think that there may be some positive signs coming out of that wider work. So, for example, the Mayor of London's new action plan for tackling rough sleeping, the shift away from verification for rough sleepers, and the new ending homelessness hubs may help to decrease demand for rough sleeping services in the city. And with the focus on sub-regional arrangements at the moment and funding, there's possible additional opportunities for accommodation and support, especially for people with unclear immigration status, though the longer term funding for that is yet to be announced, but that probably will become clearer towards the end of the year. But the other main thing to say is in the City of London that some of the characteristics of the rough sleeper population here signal a need for an enhanced service response in some areas, and I'll go on to talk about that in just more detail in just a moment. So if we go on to the next slide. Thanks, Will. So what the review found was that there are many successful outcomes with rough sleepers, but there are some factors that impact on the success of services at the moment. These are sort of essentially the population characteristics, as I've just said. So the City of London continues to have a very high rate of flow, new rough sleepers and transient rough sleepers. The corporation also has a higher than London average of stock rough sleepers. That's a sort of longer term entrenched rough sleepers. There's a significant proportion of non-UK nationals, and that includes people with no recourse to public funds. There are a couple of quite large and well-established encampments, and that makes it more difficult to engage with people. And there are an increasing number of rough sleepers under 35, and they have, I'm sure you're aware, it can be more difficult to find move on for that group because there are less affordable accommodation, long-term accommodation options. And so I think the review, when we did it, identified a number of issues that relate to those population characteristics or needs. So capacity within the street outreach service. I think the point to get across is that the population characteristics can make it that there is an issue in some cases about capacity, but the population characteristics, if you like, can make it less likely that people will engage with services. So the high flow and high transient can make it more challenging for outreach workers to meet everybody and certainly to assess everybody, and the capacity and the amount of time it takes outreach to do that means they have less capacity for casework, including for people with more multiple and complex needs. And transience also affects rough sleepers' engagement in structured substance misuse treatment. We had many positive comments about the assessment centre, and I think that looking at how the assessment centre at Snow Hill Court works brought out some interesting issues. On the one hand, people were very positive about the fact that the centre accepts referrals of people who are entrenched and people who don't have an active welfare benefits claim. So that's really good in terms, has a very positive impact on helping people to get off the streets immediately. But there's a sort of, the review sort of highlighted the other side of that, if you like, that there can be quite a high concentration of needs in the assessment centre, and that's sometimes can lead to housing management challenges. And with the concentration of needs as well, that can make it harder to move people on to move on accommodation, and just to have the capacity to help people to move on, especially when they need to go to other areas, of London or other part of the country. As we said, that there's a lot of people in the City of London who are sleeping rough who are not UK nationals, and quite a lot of people need some support with immigration advice to resolve their immigration status and help them move into either employment or housing. And we did find some evidence really of undercapacity in immigration advice, partly because the commission provider at the moment, Praxis, doesn't have that capacity itself. And so this led us into discussions possibly about how that could be resolved in terms of obviously not giving the legal advice, but the sort of bit that goes before that, if you like, for sort of gathering evidence, and whether there could be a bit of rethinking about how the evidence to support an immigration application could be dealt with, excuse me, either before people move into accommodation, Snow Hill Court or another accommodation, or while they're there and before they're referred to for specialist support. We found that, or what people said to us was that the city's approach to rough sleepers involved in antisocial behaviour and living in encampments, it strikes a good balance really between support and enforcement activities. But sometimes outreach workers or other staff who are involved in meeting people and working with people in encampments perhaps don't have enough expertise or confidence in working with people in those particular situations. And there's also, it seems, some particular restrictions from Park Guard, for example, about how they are able to tackle antisocial behaviour caused by rough sleepers who are in encampments. There was positive comments about the accommodation pathway that the City of London provides, but there is this issue about increasing demand and a sort of a discussion really about whether there needs to be more provision or perhaps a review of current provision. And the example that was given was of the lodges, and whether there might be some review of which clients the lodges take, and making sure that the priority goes to sort of city clients. And the other example that came up was about the MIST services capacity to work with clients with multiple complex needs, also making sure there's enough private sector move on. Yeah, thank you, Will. Yeah, we'll move on to the next section. So looking at sort of use of grant funding, we thought that there's a few specific areas where it might be good to review how the current services are operating. So firstly, around the outreach health van. So we felt that uptake is good, but it might be increased by changing the locations of the sessions sometimes during the week and having an associated building for the service. In relation to the homeless health coordinator, we felt it might be good to clarify that there seems to be clarify the role going forward, and a possible focus for the role going forward is to focus on working with hospitals to improve discharge pathways, and then also with the rough sleeper navigator service to review engagement with transient and high risk rough sleepers particularly, and how to really coordinate multi-agency support. Thanks, Will. And then moving on then to partnerships and integration, we found there was many areas of effective collaboration in the City of London. So that can relate to work between outreach staff and accommodation providers, or outreach with substance misuse providers, and also the inReach at the assessment centre and the Beam Alternative Giving campaign. One thing that was apparent was through looking at the HTIC data, there seemed to be a low incidence of people with rough sleeping experience who were approaching housing options, or at least were being accepted for a prevention or relief duty. It was evident there was very high ongoing demand for statutory homelessness and adult social care support, and that sometimes that might mean there's a reluctance to investigate statutory duties and carry out the full risk assessment. And there was a sort of parallel conversation really about capacity and who might be best placed, either statutory services, the adult social care specialist social worker, or perhaps services in staff and commission services, who might be best placed to gather some evidence. And with that came a conversation, I think, about whether there was a consensus that that more adult care assessments would be advantageous, but who would be best placed to this, and do voluntary sector services have enough confidence about how to what evidence would be needed for that, I think. The other thing that came up in relation to the specialist social worker role was about the sort of expectations on the single role holder really, and whether they are realistic. There were expectations about enacting culture change, I think, within social services, and whether that was really realistic and how that could be looked at again. We thought that there might be a bit more scope to work with City of London businesses. And finally, the potential really to look at a wider homelessness prevention offer. So this would be obviously to prevent people who are City of London residents getting into the risk of homelessness and rough sleeping. And there's a possibility, I think, for that to be aided for people who've lost social tenancies. They might be aided by the proposed merger of the Homelessness Prevention Grant and Rough Sleeping Grant from 26-27. Thanks, Will. The service impact, we thought this was pretty good. The service specifications and the KPI sets that I looked at all indicate comprehensive outputs, outcomes and targets, including around demonstrating the effectiveness of partnerships. But it's also clear that the profile of sleepers in the City of London does impact on data collection in some areas, especially about health needs, which I think is just difficult for outreach to collect that, as well as all the other information that they are responsible for collecting. Thank you. And then just moving on to finish off with some of the recommendations. So the first one here is that we're suggesting that there should be more dedicated outreach resources to work with StreetLink and other flow rough sleepers. So that would free up other outreach staff to do more needs assessment. We think it might be useful to have a staging post to improve throughput from the assessment centre in Snow Hill Court. And what was suggested to us would be a 10-bed unit, possibly with a 3-month length of stay. And we thought it might be an idea to consider prioritising people who are awaiting move on to PRS tenancies in other local authority areas, or people with no recourse to public funds who are likely to receive a no merit advice decision. So that, that would be a negative decision. There seemed to be a definite need for more immigration advice and casework, as I was saying, partly because of the proportion of people who are non-UK nationals, and also because of pressures on Praxis, the commission provider. So we thought it's worth the City of London thinking about providing some immigration advice directly. We also think it'd be worth considering having a specialist move-on team that would help throughput from the assessment centre at Snow Hill Court and other parts of the accommodation pathway, and that learning might be gained from the recent Thames Reach pilot, which seemed to have some success around addressing common barriers to move on, such as rent arrears. But we also thought it might be worth looking at reviewing people's progress after they've been at Snow Hill Court for 28 days. We heard that some people some residents are not always fully committed to engaging with the move on process, and it might be worth having discussions with people at that point and thinking about how that could be encouraged. In terms of the private rented sector, in the City of London, as elsewhere in London, continues to be a crucial source of move on. So it would be really important in the new commission service that there is room for enhanced incentives for landlords to encourage their involvement, to increase the number of units available, and with particular reference to shared accommodation for under 35s. And in terms of the review of the navigator model, speaking to stakeholders and looking at this practice ourselves, we think there could be some learning here from the City and Hackney STEPS project, which is supporting transitions and empowering people service. That's what it stands for, which provides a very sort of intensive model of outreach, integrated health and social support. And then finally, we think it might be worth thinking about expanding the accommodation pathway for people with who have been proved to have no recourse to public funds. So not placing everybody necessarily in Snow Hill Court, especially those with complex needs, complex support needs or complex immigration needs, because what we found is that the 2 dedicated bed spaces for no recourse people are very, very valued, but that the process can be slow, and so there can be a silt up of those spaces. And so it may be worth thinking about if additional spaces could be provided elsewhere. Thank you, Will. And then finally, on this is just the second set of recommendations. So we think it might be worth thinking about having a specialist encampment sub-team, and to develop work with the community safety team, other commissioned services and city police, so to really develop the multi-agency approach. So that would include strategies for the different encampments that exist in the City of London, a communications strategy for voluntary sector staff around the risks of people living in tents, so really to empower voluntary sector staff to give out those messages to people who are living in the encampments, and to be backed up with operational protocols and coordination of work around crime and antisocial behaviour within the street population. We think it might be worth, in relation to the business improvement districts, it might be worth exploring with them whether there may be a potential source of future funding for rough sleepers. I think it's going to be really important to carry on training for all frontline staff in commissioned services, City of London officers and the police around a range of issues. So depending on whether you're on the statutory side or the voluntary side, the programme, if you like, would probably need to cover statutory homeless framework, social care frameworks, safeguarding, working encampments, support needs for rough sleepers, and effective engagement with offers of accommodation and support. We think there's clearly a lot of discussion that goes on between City of London officers and the commissioned services already, but we thought it might be worth instigating new sort of good practice discussions, really, just to talk through how decisions have been made recently about statutory homelessness acceptances and Care Act applications and acceptances. So how the decisions are reached. That might be a way into talking about how evidence can be gathered for both processes, and who is best placed to do it, and how care thresholds particularly are interpreted. And then finally, to develop the data collection a little more. So some suggestions for that came out of the review are the percentage of people who are sleeping rough in the city who have a needs assessment. So that would include people, it would go beyond what's gathered now to include what proportion of that figure relates to people with no recourse to public funds and those who are in encampments, the proportion of people who are in Snow Hill Court who have immigration issues, and the proportion of people who refer to either housing options or adult social care in the City of London. So we think that would have advantages. So it would help outreach, for example, focus on engagement tactics with rough sleepers who do not currently have a needs assessment, and it would build understanding really of the percentage of the caseload who actually need support from praxis, the specialist support, because it's possible that through evidence gathering by other staff that some for the immigration issues might be able to be resolved, and without the need for referral to praxis, particularly those people who are EU nationals and perhaps at some point had an EUSS application and perhaps that's lapsed for some reason. That would just be one example. So it would just give a clearer picture really of what the demand is for specialist support, and that might help determine the need for additional immigration advice support, either via an external commissioned organisation or through the City of London, should that route be decided to do it directly rather than in a commissioned manner. So that's just a very quick run through some of the findings from the review. I hope that was helpful. I don't know if there's...
Well, thank you very much, Helen.
Yeah.
And Adriana and Sophie for what was obviously a broad and a deep evaluation of our services. So thank you all, and for your presentation. Town Clerk, can you guide me in terms of opening this out to questions? If Helen, you are fine taking questions, I think.
I'll try my best. Yes, thank you.
Great. As this is an information item and we're going to be taking no decisions on it, would it be acceptable to ask members of the corporation who aren't members of the subcommittee to feel free to interject and ask questions if they so desire.
Do you mean those attending online or those in person, or both?
Well, both really.
Well, it's at your discretion. And again, it's an information item.
Marvellous. In that case, I'd like to take a maximal approach to this. So if you're a member of the corporation or the subcommittee and you have questions or observations, feel free to raise them. David.
Thank you, Chair. I'd just like to support the need for immigration advice. So because of my personal experience, I was asked to do a bit of casework in relation to this for a rough sleeper a few months ago. Found it very difficult to get tier 1 immigration advice in a very straightforward set of circumstances relating to late application for pre-settled status. That piece of work could be done really by any generalist advisor with the basic training in tier 1 advice. What was unfortunate then is that the only option was the praxis drop-in session, or city advice, technically speaking, at that stage purported to have a tier 1 service. So I spoke to them and they said, unfortunately, they no longer have that capacity. So although the city's agreement with them included an intention that they would be a source of such advice, they don't have at the moment the competence or confidence to give that advice as part of that service. So we've lost one of the other organisations, in fact somewhat easier to get to than Praxis if you're in the centre of London rough sleeping, and so that's a real shame. And I think that that's something we need to think about, as well as the Praxis option. We need to be looking at the contract that we've got with Toynbee Hall and looking at what support we can give them to bring that service back into the scope of the agreement that we've got there. So the other thing is there needs to be some urgency about this, because those people that applied for pre-settled status in line with the government's original timetable have it running out at some point in the middle of next year. So for those people that, and many people living more complicated lives won't have done this, but there will be a cohort, a significant cohort, whose leave pre-settled status runs out in 2026. And for those people need to have their full settled status resolved before that happens. And if that doesn't happen, there are very significant disadvantages. We are concerned as advisors nationally that the Home Office are likely to take quite a difficult approach to those who are making late applications, having given them 5 years in pre-settled status. So that work really needs to be in train now for those with complicated needs, perhaps criminal history, those sorts of additional complexities, in order to get a decision before the lapse in 2026. So unless we act on this now, the picture in terms of the falling away of recourse to public funds and very complicated immigration advice is going to come on us very quickly. Whereas if we deal with it now by funding some tier 1 advice, a lot of problems will be triaged, because the pre-settled status application, albeit out of time, will still be available to a lot of those people. So we really need to grasp that nettle as quickly as possible. Otherwise, in 12 months' time, we're going to find that those needs are very much more complex than they are at the moment.
Great, thank you, David. Might I suggest that that is a question we need to consider right now, but it's less a question for Helen than for our officer team. It's about our provision service. Will, would you be okay picking it up?
Certainly, Chair. Thank you. And I completely agree. I think we all recognise that immigration advice is critically important, that it's in significant demand across London, and there is a significant lack of capacity across London. There are good services, but there are long waits to access them, and frankly, it's not really adequate at the moment. So we are looking at the funding that's available within our funding envelope for this year to see how we can use it. We're not in agreement quite yet about how to get to that advice. And you're right about city advice. One of the considerations is, can we use the existing architecture that we have in place and just strengthen it using the funding we have available, or should we go and start from scratch? But finding OISC qualified advisors is very difficult. It does beg the question why more people aren't qualifying, because it would appear to be a vibrant market. But yeah.
Oh, sorry, Helen, I'll bring you in a second. In terms of David's point about the timing and the urgency, is there anything we need to consider sort of in the here and now on that in terms of action?
I will take the deadlines you suggested away and make sure that we fully understand them, so that we're engineering that into the solutions that we're looking for.
Great, thank you, Will. Helen.
Yes, thank you. Thank you very much for the presentation, Helen, and for the work on this. I have to say I found it very helpful and thought-provoking. I've got a number of questions. I think most are probably though for officers rather than for Helen. But if I could start with one about which Helen may be able to help with, which is the change in demand, because I think what you were saying, Helen, is that the demand may reduce because of some of the changes in service. However, when I looked at the Nell Regional Commissioning report, it showed that City compared to other local authorities was massively high, you know, really strikingly high. And when I think we've looked at trends and patterns before, we can see that those numbers just keep going up year on year. So I don't know if it might come down or the trend will continue to be up. If it's continuing to be up, then there are a number of questions that flow from that about the resourcing level. And there were 4 areas, I think, Helen referenced in the findings and recommendations that I spotted, and there may well be others. So the first one is a move on team. The second is a 10-bed unit. I think the third was about immigration work, and there was a 4th round about healthcare data, and then our response, having collected data, how are we going to respond to it? And I'd be interested in the officer's views on each of those things. The other context question, I think, is that is there any I don't want to phrase this in a negative way, but I guess it's to do with discussions with our housing colleagues, and I know that you do, but where we are new building, and we've got 2 or 3 in the pipeline for new builds, can we build anything in around homelessness, rough sleeping into those new build areas, thinking about, you know, regeneration programs, and some of them are, you know, much bigger than others. The second thing is what in our housing waiting list, what sort of priority do homeless, rough sleeping people get? Because we will be populating Blackraven Court. I don't know what the allocation is on that so far, how much of it has already been offered up, and whether there's any scope to think about supporting people there. So, and a final comment is absolutely, we've got to work with the bids. You know, we get businesses talking to us about not wanting homeless people in their doorways and other places, but where is the hand in the pocket to say, let's help you try and manage this problem and see it as partly our problem, not just your problem. Thanks.
Great, thank you, Helen. Well, over to you.
Thank you, Chairman. Thank you for the question. So if I go back to the grouping of recommendations you made, I mean, I think, well, first of all, I think it's probably no surprise that the vast majority of the content of the report was familiar to us on one level or another. Some of it invites you know, more investigation than others. Some of them I think we're already, you know, pretty we understand pretty well, but it's good to get the validation from the review. Some of the ideas, some of the recommendations, like for example, additional staging posts and more beds to help throughput from the assessment centre, I think we recognise as being a weakness in the way we're set up. I think the question is where we find the resources, the revenue resources and potentially the capital as well to do that. But that links possibly to the sub-regional work that we're looking into to see whether there's a sub-regional solution that could help us with that. I think we picked up the immigration advice point. When it comes to resource allocation and outreach, I think this is a particularly interesting and emerging area of discussion, particularly around our data analytics and gaining a better understanding of the nature of the city's rough sleeping cohort. We are seeing high levels of transit, so people are passing through the city, and there's an obvious dichotomy between the work the outreach team have to do, which is split between long-term complex caseload with people they come to know because they rough sleep in the square mile, and the people that are constantly passing through. Now, both of those things need a response, but I think they need very different responses. And there's a question mark for us about the proportion of allocation to one rather than the other. And I think there's definitely a case for thinking more about how we're meeting the needs of that group that are rough sleeping in the square mile. So making sure that we have the response right for new rough sleepers, but I think where impact can be found is probably with the other group, which is people who are rough sleeping in the square mile. It feels like that's more in our gift to do something about.
Thank you, Will. Helen.
To follow up, I mean, I understand all that you've said, but when we're looking at the new builds, we're talking with developers. That is the time, that is the opportunity to say, as part of this build, you know, there's a requirement to contribute to the community in some shape or form. It could be through Section 106 monies. It could be by providing a community space. You know, there are a number of different options around new builds that really must be explored at the development stage, not at the time the submitting plans. It needs to be built in. So I think there may be some scope, you know, especially when we're looking at new projects coming on. Maybe the ones I've mentioned are still kind of, I've probably got too far down the line. But I do think that we have to explore every opportunity, and 106 has got to be one of those things, I'm sure.
Thank you, Helen. Chris.
I mean, thank you, Ellen. And I agree, and I think it's helpful, and I perhaps that's something that we will take away from this and that question back into the work that we're doing with Peter and the team in terms of this, you know, the strategic approach. But I mean, what I would say is that in terms of vulnerability, it's always foremost in our minds and in our conversations with colleagues in housing anyway about how we are prioritising allocation. We have housing first options that we can look at, for example. We already know about care leavers, who are a vulnerable cohort of young people who could end up being homeless and rough sleeping, and we've got priority there through our protected characteristics policy of the corporation. So, but looking at the more strategic approach that you're inviting us to consider, I think that's really helpful. I'm happy to take that back and talk to Judith and Peter about how we can weave that into our thinking moving forward, or be more explicit about that, perhaps.
Great, thank you, Chris. David.
Something that was very tactfully dealt with by Helen was an idea that maybe it's right to look more closely at where we owe statutory duties to rough sleepers. And I can understand from a resource point of view why people are reticent to accept statutory duty. But without delving into that, maybe not now, but could we just have some information about the amount of street homeless or rough sleepers that have been accepted as us owing a statutory duty to house over the last few years, to see what proportion of the numbers that we're also familiar with from the reports actually links into an acceptance that we have a statutory responsibility to house? Because I think it would be useful just to kind of get that as a member. It would be useful for me to understand that, and I don't think we've had that information before.
Great, thank you, David. Well,
yes, I'm certainly happy to take that away. I mean, just a important point of clarification. So we have a duty to provide a homelessness, take a homelessness application. It doesn't necessarily lead to a housing duty. But yes, absolutely. I think this is absolutely a valid question to ask. So we can bring that data back into you. Just in the meantime, just to reassure members, we're currently in the process of increasing the size of the statutory homelessness team to bring in more capacity temporarily so that we can start trying to bring more rough sleepers through, or make sure that there's no barriers to rough sleepers who wish to access the City of London for a homeless application.
Great, thank you, Will. Any other members? Well, in that case, Helen, just as I suggested earlier, thank you and your colleagues very much for your work. It was clearly broad, deep. The recommendations have landed and clearly provoked discussion. I hope and trust the report won't be set aside, but will now be taken forward. And thank you very, very much.
Thank you very much for the opportunity to come today and for the comments and insights afterwards. Okay, thank you. Bye.
That's pleasure. Thank you and goodbye.
Bye. Bye.
Now, 10 o'clock, the next item, 5, the City of London police update. Do we have Nikki Gander online?
I can't see her online, but we do. There is a slot later on in the agenda under the non-public section. It might be that she's running late. But...
Yes, absolutely. Well, we can pick this up later if need be and if able. Otherwise, could I just ask, I mean, we are getting these as verbal reports at the moment, and I believe, you know, the legacy or the, you know, historically we received written reports. Would it be possible for us to ask the City Police to provide us with a written report to our meetings? And clearly, it would be helpful if they attend. We do have issues with encampments. Town Clerk, which officer is happy to pick that up? Thank you.
Hello everyone, we've not met before. My name's Phil, I'm the new interim head of community safety. I'm working very closely with Chief Inspector Garner on this, so I'd be happy to take that away.
Marvellous, thank you, Will. And yeah, I mean, if Nikki turns up later, that'd be great. But otherwise, if you could, that'd be really appreciated. Will, would you be all right sending an email to members of the committee just advising or sharing the report if we have one?
Yes, I'm not familiar with a written report for this particular meeting, but moving forward, absolutely, I'll make sure.
No, I was unclear, but I mean, if we don't have attendance and a verbal report, could we get a written report?
Of course.
After the event. Thank you very much. Right, in that case, moving on to item 6, which is with you, Will, I think.
Thank you, Chairman. So this report provides members of the summary of progress against the aims set out in the current homelessness and rough sleeping strategy. The report usually covers 2 sections, the strategy delivery plan and the performance scorecard. Unfortunately, Q2 data is only available from today, so this report is limited to the strategy delivery plan only. My apologies for that. I will circulate a completed performance scorecard amongst members later in October. On this strategy delivery plan, 47 actions have now commenced and 26 actions are completed, which is 3 more in the last period. And a summary of completed actions can be found at Appendix 1. 3 new actions have been added to the plan, bringing the total number of actions to 53. And just a final note that we are exactly halfway through this particular strategy now in terms of reporting periods.
Well, thank you, Will. Members. Metaphorically, oh, Helen.
Sorry, it's actually not it's not really a question about the content of the paper. It's simply an observation that because of the print size, it's almost impossible to read some of it for those of us that are a bit visually challenged, even with the bifocals.
That's noted. I can't read it either, but now I can see that. So,
I mean,
my obvious plan is
the obvious thing is that because I can't read it very clearly, there might be stuff in here that I want to comment on, but
of course I'll make sure we present it differently next week.
Marvellous. Thank you both. Patrick.
Just in terms of the developing the recruitment practices to increase sustained representation, do you involve people with lived experience in interviews and recruitment as well? Thanks.
Where we can, yes, and we're starting to on our procurement processes as well. So yeah, where we can, this is definitely something that we're trying to weave in automatically.
Thank you both for the question and the answer. Members, any other points? In that case, we'll move on to the next information item, which is 7. Will, with you, I think.
I think so. Bill.
Apologies.
Thank you, Chair. And hello again, everyone. Thank you very much for the invite to this today. It's nice to come along and share the work with you all. I am very happy to either take the paper as read or just give you a very sort of couple of paragraph overview on the work that's been done since the last paper that came in December.
I think the latter, if possible.
Of course, very, very happy to. So this builds on the paper that came before you all in December last year, tackling the detrimental impacts of rough sleeping. Subsequently went through various boards, including Police Authority Board and the DCCS. This is really just to give you a high level update on the work that's been done since that time. So as outlined in the report, we recruited on a 12-month fixed term contract a lovely lady called Barbara, who is my coordinator for our rough sleeping work. Works very closely with Will's team and others, and with the police, including Chief Inspector Garner. And she has been tasked with really coordinating our response as partnerships to some of the more intractable issues in those spaces. In June, that was in May, in June, we started a joint working group, which is chaired by Chief Inspector Garner, involves many teams internally and partner teams as well, where we look at on a monthly basis some of these, as I say, more intractable and challenging spaces and individuals that we are looking to work with, and what our future plans may look like with those individuals and with those spaces. That group is working really well. I think it's got a good grip of the issues in the city. It has the right people around the table operationally and strategically. It's being led really strongly by the police. I've only been here a couple of months, but the few of them that I've been to, I've been impressed with the grip that they've got. One of the sort of main activities, no, before we started any work, just to put your minds at rest, we've conducted an equality impact assessment on all of this work that we're doing. I've taken a lead on that myself. We are seeing either neutral or, in a few minor cases, positive outcomes as parts of this work through the EIA. Whilst rough sleeping in and of itself and homelessness is not a protected characteristic, we recognise that many individuals who are rough sleeping may have protected characteristics themselves through their physical or mental health, low numbers of occasional pregnancy, protected characteristics nonetheless. And so we've done this impact assessment through that lens. And our legal teams had an eye on that as well. On a practical level, we are conducting monthly days of action, we call them. The last one was actually this morning. And I just had the report through while we've been sat here, and I can see that they removed 4 tents and they've taken around half a ton of rubbish. It seems to be about right, half a ton, 500 to 600 kilos once a month are being removed from the streets. We are using environmental notices on tents which, in support with outreach colleagues, tents that are abandoned, we're taking those away. Property that is increasing fire risks, we'll put a warning, my apologies, we'll put a notice on those, either 7 or 28 days later, depending on the legislation we're using, we'll remove those, so try and mitigate the fire risk around that space. And supporting through the outreach teams and others that continual engagement with people in our encampments or lone rough sleepers. So we are working through the street cleansing team and through other governance people around. Everyone on this side of the table sort of comes along to these meetings. Well, I'd like to think they're going rather well. We are also working with our legal team to look at what the proportionate legal response is for enforcement. That is a path that we are treading very carefully. We are being very proportionate, very slow and steady. When we're removing items, we're doing that with the blessing of our outreach team, so that we know that they are okay to be removed and we're not leaving somebody in a worse predicament. When we're removing fire-related items, we're doing that very carefully as well. So it's a very measured tread that we're taking. We have not taken more robust enforcement action yet, although we have a protocol that's been designed which requires multiple director sign-off. And we are looking at our first space for taking that action. And others may or may not come up in due course. I'm taking this as slowly and steadily as I can to make sure that we're putting the individuals that need our help and support right at the very heart of it, and enforcement is the last resort, but it is a resort. So we're getting there. Lots of work still to be done on this area, of course, but I would say that certainly since May and June, when the additional resource came into the team on a 12-month fixed term, I'm hoping to make that longer, and this governance structure around it, we're really starting to embed that, and we're starting to see, one thing I didn't mention is there is a Teams channel online where all of our partners, including police and support services, they're talking all the time. I had to turn the alerts off because I get literally 100 to 200 messages through that, because this is a space where everyone's talking to each other. So, and that's not just enforcement, that's support as well. So we're in a position where, as a partnership, we can be responding in hours, not days. So good direction of travel so far, but still lots to do.
Thank you very much. And members, we heard in agenda item 4 in the evaluation that there was approbation for that attempted a sensitive balance between enforcement and support. As we've heard at other subcommittees, a sensitive approach towards the health and safety issues as well, and mindful of anti-social behaviour issues that can sometimes be consequent upon. Members of the subcommittee, any questions, observations? Patrick.
I feel good to meet you. Thanks for the report. Thanks for the reassurance around that kind of welfare first approach, which is really good to hear. In terms of the homeless link review and the report, Have you been part of that? Are you part of putting those actions into being and influencing or being influenced by those?
So definitely being influenced. The report was written before my time. When I say I'm new, I really am quite new. So yes, absolutely looking at that report as the lens through which to take these kind of joint actions.
Marvellous, thank you, Phil. I can see Will online.
The only thing I would add on that, Patrick, is I think when the review is undertaken, I think there's some comments in the review around officers perhaps being unclear about what steps they can take and how to organise that work. And I think that was probably valid at the time. I think the work has progressed a lot since then, going back to when we presented the first tackling the detrimental effects report and the subsequent protocol that emerged from that. And I think what Phil's been able to articulate through the paper is it's really galvanised a multi-agency approach, which is balanced and proportionate. And we've been executing that pretty effectively, I think. I don't want to minimise the fact that there are still hotspots and that's affecting communities. But my observation, I was out this morning on the operation, is that they are smaller and they are safer and they are cleaner. And that is not an exaggeration. I think around half a tonne of waste was removed.
Great, thank you, Will. I can see some hands going up in the room, but Sophia raised hers online. Sophia.
Oh, hello, Chair. Thank you very much. I think it's great, everything you've been saying about removing dangerous hazardous items, etc., and the welfare of these people. I am slightly concerned still by the cleansing of the streets and the walkways. I'm in Queenhithe ward, so alongside Castle Baynard. Then we have Queenhithe, Vintry and Dowgate, and we have quite a lot of rough sleeping. There's a lot of people urinating. It's not very pleasant for residents, for workers alike, and obviously for these people, they have nowhere to go to the bathroom. So is there anything we can do from that point of view, please?
Thank you, Sophia.
Thank you for the question, and of course I completely agree. I think I can certainly speak for my team, and I think the officers take their responsibilities very seriously. We do recognise we have a responsibility to our community, and to create a safe and clean environment. So the kind of work that we've been doing, so today I witnessed a cleansing operation involving a pressure washing team. That was obviously focused topically on one particular location, but as Phil's mentioned, there is a Teams chat group which is being used very effectively to provide live updates which our colleagues in cleansing are able to respond to. So compared to the kind of way communication worked a couple of years ago through lengthy email chains, I think we've actually got a pretty effective, found our way to a pretty effective way of working. More practically, I mean, the outreach team are very good at signposting people to where toilets can be found, and lots of businesses will open their doors and their available toilets to rough sleepers to use. And of course, we have quite a number of fantastic democratic spaces that can be accessed free of charge as well. So there's a signposting piece of work to be done there as well.
So thank you for the question and the answer. Helen and David, I think it was.
Yes, thanks. And sorry, Phil, I'm grabbing an opportunity because you happen to be here, but it's an issue that's come up twice now in my and Deborah's ward, which is, I think it's a boundary issue more than anything else, but it's homeless, rough sleeping people on the stairs at Barbican Tube, leaving drug paraphernalia. And I think the other day we're trying to cook sardines and so had a fire up there and then left all of the stuff after it, and it's really difficult because people here in city will ring city police, and city police of course will say, well, it's not us, it's TfL, and that kind of passing around isn't terribly helpful. And it's kind of across the road, can we, and I understand the difficulty, but it would just be so easy if, given the closeness, if we could have an arrangement whereby in an instance like that, in a very busy, heavily used area, we could just fairly quickly get a clean-up team in.
Thank you, Helen. As that's quite a particular question, David, can we stack up a couple of questions?
Just a couple of things. The first one I wanted to ask about was the pallets. Is the purpose of the pallets to lift people off the floor for sleeping? That's the okay. So in respect of that, is there more we can do to give people something that isn't a pallet to allow them to do that? So where we've got entrenched rough sleeping, couldn't we provide something you know, a memory foam self-inflating roll mat of a suitable standard to protect from cold from the floor in the same way as you might have if you were camping, because presumably there's a significant health and safety risk about the amount of wood that's being brought in to kind of build those structures, and surely something soft is better than something hard. And then yes, I've forgotten the second thing, so I'll come back, but yeah, just about that. I wonder if it's something we can do.
Yeah, I'll begin picking up. I think Phil might have a contribution as well. Yes, I mean, it's regrettable in a way, but we have been focusing on removing flammable material. That's a particular concern, and pallets and cardboard have been building up, and the placing of pallets under the tents is a particular concern, because if for example if dropped lit cigarettes fall through there, there's a draft and there's flammable material adjacent, and it's a risky situation. But the reason they're used is because it adds a degree of thermal protection from the ground. So when we are removing them wherever possible, we're doing it in consultation with the rough sleeper, saying we're going to need to, and usually they'll give us the pallet. I think to come to your other part of your point, which, you know, is, I understand the problem with that from a professional ethics point of view is taking steps that might be seen to be supporting or sustaining rough sleeping rather than seeking to end it. And this is a tricky area, but it's not a step that we've taken up to now, and there isn't currently any plans to provide sleeping equipment.
Thank you very much. I've remembered the second part. I think I understand that. It's going to be very difficult to end the bringing of pallets if there isn't an alternative. But equally, I think I probably agree with the current position that I think you're likely to make a problem worse, and diversion I think is better than that. So yeah,
supply pallets is an issue, so we've been working, but it's also there's also an enforcement angle for our colleagues in the environment team, because loading bays should be secure and pallets shouldn't be obtainable, really speaking, if waste is properly disposed of. And that's something I'm talking to officers in the environment team around. I'd probably manage expectations around ready and quick solutions to that, but yeah, I mean, I completely agree.
And just in respect of that, can I say that might be our in to some of the businesses, because I think there are a few around my paths around the city. I know a couple of serial offenders who leave that sort of waste outside their loading bays. That might be a nice opportunity to say, look, our enforcement team have noticed that you are frequently contributing to this problem of pallets. Would you also like to contribute to some of our work where those pallets are ending up being a risk to people in a very vulnerable situation? That might be quite a nice path to engage a business who might then be able to put forward a very credible piece of work in respect of their own community responsibility. The other thing I wanted to say is I think we all knew when at the last meeting there was a talk that perhaps there's a path to enforcement coming in respect of some of the encampments. When that's closer to happening, can we just be kept informed about what plans are in place around that potential action to make sure that we have some oversight over the whack-a-mole effect? Because whenever that happens, we're going to need to think very carefully about where those people are likely to go and what that's likely to look like, you know, in other parts of the city. And I'm afraid to say, I think when that happens, those entrenched concerns for those individuals are not going to change overnight. They're going to find somewhere else to go, probably, rather than come off the street. And so, yeah, I just want to make sure that when we're getting to that stage, we can have some conversations here about what other support we're going to put in place around that enforcement action.
Great. Thank you, David. Yes, something that's a bit of a theme, and I'll do my best to frame this in my own amateur way, but is, you know, people are dealing with issues that sometimes cut across agencies and they move between boundaries, and that sort of aligns with Helen's question. So, Phil, if you could maybe pick those up.
Thank you, Chair, and thank you for the questions. So chronologically, thank you. This is another useful example that I'd be very happy to take away and talk with you in a little bit more detail about these experiences, because those conversations are ongoing, and some more practical examples like this would be very useful for me to take away with just checking she's not on yet, I don't want to speak for her, but with Chief Inspector Garner. Those conversations around that boundary space, they are conversations that are being had, and so these kind of examples are really helpful for me I wasn't aware of these ones. So useful for me to have them on my radar when we're having those conversations. I can't make any promises about what will end up, but this is useful content for me to take to those
Just
spaces.
to say, Commander Khan knows about this as well, because I think Deborah and I, both being on the police board, have raised it with him, and so he's very familiar with it as well.
Great.
So anything you can do would be helpful.
I'll absolutely take that away, and I'll commit to bringing that up in the next conversation we have with them. Not quite as articulately as Will put it, but what I was going to say around the pallets is it's absolutely right. It feels morally correct, but it's not justifiable to be presenting those as sleeping mats and the likes at the moment, as much as it pulls the heartstrings, especially as the nights are getting colder. It's like you've alluded to, it's an upstream issue. If there's pallets showing up, they're not secure. We've got igniferous materials around the sea that aren't being held in secure docks, and those are conversations that, again, at the most recent working group, Nikki was raising that maybe these are conversations. So we were on the same page about the direction of travel for the conversations into those organisations. And if anybody can turn a business upside down and shake money out of their pockets, then it's Chief Inspector Garner. So.
Great, thank you. And then there's sort of the issue that we might, when we move into enforcement, need to be mindful that we're not simply shuffling people along to be someone else's concern.
Yes, and it's valid. It's absolutely valid. The displacement and losing sight of people. There's a two-parter to that. One, what I'm learning is that we've got really good lines of communication with other neighbouring boroughs. People who have been rough sleeping in our spaces, if we don't see them for a few weeks, excellent chance through our communication with other boroughs, we'll know exactly there's a chap who'd not seen for a few weeks. We know he's in Royal Borough of Kensington and Chelsea, and we know that he's planning to stay there for a few weeks, and we know that he's engaging with support there. So what I'm learning is that we've got those good lines of communication through the outreach teams with other boroughs, which is really encouraging to see for me. And the second part, with regards to eyes on, yes, we'll absolutely share as much as we're able to in advance of the legal actions.
Great, thank you. And that seems, unless members have any particular concerns, to be an appropriate place to move to the next item, which is across. Oh, Phil.
I was just going to ask, with my apologies, I'm a little unwell. If I'm very happy to stay, but if there's no further questions for me from members, is there any possibility I could be let out a little early?
Well, I think members are going to send you very best wishes for LEMSIP and whatever else aids your recovery.
I'd be very grateful. Thank you.
Marvelous. Thank you, Phil. So an appropriate moment to move on to item 8, which is cutting across the city and boroughs. Can I just check, is the non-public appendix still embargoed?
Yes, the content, the pertinent content for this committee is still embargoed, yes.
Well, in that case, thank you, Will. Could we have, we should feel free to discuss in sort of the general and the broad at this moment, but if we want to move into anything that's touching on the figures and the details of the embargoed appendix, could we hold this over for non-public? But is there anything in the generality that members would like to tease out now? Marvellous. In that case, we'll move on to item 9, John.
Thank you, Chair. So this is a report just to give members an overview of the commissioning and procurement activities within Will's service area. So I'll introduce myself. My name is John Barker. I'm the commissioning manager that works exclusively in Will's service area. The report is for information so that members are briefed on what's going on, and it's proposed that we would give this update every 6 months, conscious that members only see stage 1 reports into procurements of over £2 million. So we thought it'd be helpful to give a little bit of information on what goes on across the piece. At the moment, this is not, I was rather hoping to go after the sub-regional section, but this is not inclusive of any sub-regional role that we may take on, and we're looking at that work plan currently, and we'll be doing so on an ongoing basis.
Thank you very much, John. Any questions or observations? David.
John, just in relation to what you've heard about the immigration advice, what scope is there within existing budgets and for commissioning that as a service?
Really interesting, David. Thanks for the question. I'm going to go back to my colleague Sarah Greenwood, who commissions the City Advice Service, and find out a little bit about
what has slipped off and how that's happened. So that's a note I've made for myself to do. And then obviously whether there's funding opportunities in this year's rough sleeping prevention grant award to bolster that service, and whether there's value in the contract to do so. So that would be one avenue we'll be exploring. The other one, we are waiting for funding announcements at the moment, so this is kind of hampering a lot of what we're doing in commissioning at the moment. And then of course we'll have the funding announcement and everything will explode into life. We're also looking, a big piece of work at the moment is starting on the redesign and stakeholder consultation of what our new street outreach, or what we're likely to be calling a rough sleeper support service, is going to look like from next year. And I've taken the information that Helen's given over and the recommendation from that, and we're looking at where to put some of those pieces. But definitely the first step on that is having a chat with Sarah and finding out what's going on with City Advice and whether there's anything we can do to reinstate that tier one at that sort. You seem to be quite keen that it was that local sort of at Toynbee was quite helpful.
Don't really mind where it is. I just think as convenient as possible. But you may know that the I've forgotten the name of the service, is it Praxis, but that services drop in for people who are of no fixed abode was well into Tower Hamlets, whereas if you're walking from the city in that direction, you'd have passed Toynbee Hall on the way. So it was only because it was more physically convenient than to get to that drop in, which was a long walk away, when we were signposting people to it.
We've also put a resource into the Dello Centre recently, again, which is probably on the route up to Toynbee Hall and the other stations. So we're kind of looking at where that interaction can be and where that service can go. But again, subject to funding, which is my everlasting caveat.
Great, thank you, David, and thank you, John. Imani.
Hi, Imani Smallwood. I've got two questions for you, John. One is, when are you expecting that funding announcement to be made? And secondly, I understand the GLA released their strategy earlier this year. There's going to be a big focus on the ending homelessness hubs. I was just wondering what coordination there is between the city and GLA, and thinking about where those hubs are going to be located. Obviously, it would be fantastic to have one located here.
In terms of funding announcement, last year it was late December or mid-December, which wasn't particularly helpful. Will, I think you might have a slightly better. I missed the last Rough Sleeper Leeds meeting because I was on holiday, so I haven't got that information at my fingertips at the moment. Will, I don't know if you've got any more on that.
In coming weeks, I think probably the best indication I can give of timeline. With regards to ending homelessness hubs and the GLA, there's a new rough sleeping lead for the GLA who I've met with recently, and we explored various things, and that's also part of the conversation around our role in the North East London sub-region. So there is still some conversations to be had, but yeah, I'm interested in the potential for the ending homelessness hubs.
Good, thank you, Imani and John and Will. Just picking up on David's point with City Advice and Toynbee Hall, etc. Could we maybe, John, ask you to come back to either through town clerks or directly to members of the committee with an update on how that's proceeding, because it might have some timeline.
Yes, absolutely, of course. I'll get to that pronto.
Great, thank you, John. Deborah.
Yeah, just a query on resourcing for winter. With winter, actually almost feels like it's almost here. Do we have a sort of sufficient capacity to be able to sort of ramp up our services if needed?
We've started. So an additional resource. We've recently renewed our navigator's contract, and it went to a different supplier. That's started on the 1st of September, and we've literally this week adjusted that contract, so there's some additional capacity out of our existing grant for winter capacity. What we have done in past years is used what funding bandwidth we've got to vary contracts and put in additions so that the providers can take up can put additional resources on the street to get people in. I don't know what the winter funding picture looks like. Will, that's with yourself, but we've also spoken to Thamesreach, who are doing most of the rough sleeper services in the city today, and started moving pieces around on the chessboard to get the right provisions in the right places, and that includes the encampments as well.
I can provide a little more detail. So in terms of our arrangements for this winter, we've got 13 spaces confirmed within our existing pathway, plus a notional capacity of 17 in hotels and temporary accommodation. They're not booked in advance, but that's our kind of initial ceiling for tier 1. So that gives us 30 spaces at tier 1. As John said, we've created a 6-month post for a winter coordinator to work closely with the outreach team. We have in Newham, as part of our sub-regional work, we have 1 confirmed space for severe weather provisions in SWEP, and 4 winter beds across the whole period of November to April. And we're waiting to see whether any further Panhandle provision is launched.
Thank you, Will, John, and yes, James.
Yeah, thank you. Just for clarification, the target dates that are listed, are they the actually contract expiry dates listed within the report? Five and 6.
So the statutory homeless out of hours response, that's a sort of wish list target date. We're taking that to DLT this week. That's going to be an internal service. The others are the dates the contract needs to be in place. So there's ongoing work on those. Reports have been, so health inclusion is with legal to issue the contract. So yeah, but they are the target. They are the contract dates.
Obviously, clearly busy and challenging time. I note the amount of direct awards. Is the approach for short-term direct awards to future competitive procurement? Is there an ambition to do competitive procurements?
The direct, yeah, it's an interesting question. The direct awards are for a whole host of reasons. You'd expect me to say that, I'm sure. But health inclusion, we are working with Guys and St Thomas's Trust. They're funded to do this in Southwark, Lewisham and Lambeth. And one of the contracts is in Southwark, so that's a kind of no-brainer. No one's contracted to do it in the city, and they got special dispensation to provide that service at Snow Hill Court, and they got director's approval to do that. So we're carrying on with them for a short period of time, for 2 years, looking to see if another provider comes into that market. The lodges is a difficult one because we commissioned this 50-50 with Westminster. Westminster try not to do competitive tenders where the provider is the leaseholder or owner of the building, because it usually ends up in the building being lost to the sector. So we're working with Westminster, aligning our contracts for about 2 years on that one. And that sort of feeds into what Helen was saying about the use of the lodges over time. So that's the idea of a direct award for the lodges, and kind of similar with low to medium supported housing at Crimscott Street. There is a historical link to the lodges with that one, because the provider moved from the lodges into Crimscott Street to allow the lodges provider to move into the lodges. So we're untangling all those leases, but we're looking to direct awards so as not to lose that property to our pathway.
Yes, so it's effectively moving yourself to a future position when funding is sort of more certain, to then be able to make an informed decision over longer procurement strategy.
Yeah, and future-proofing the services as well, making sure that we're sort of in a position to design services that are good for what our future demand's going to be.
Great, thank you, John and James. Right, if members are content, we'll move on to questions. Do we have any, Town Clerk?
Thank you, Chair. None have been received in advance under item 10.
Members, thank you. Members, do you have any? Right, in that case, items that I consider urgent. Well, just a couple of updates really, and a question. First, it was a great pleasure to attend an event last Friday organised by Groundswell with corporation support. It was referred to earlier as co-production, and it's a really interesting initiative to ensure we're shaping our services and engagement properly, and it is informed by people with lived experience. It was fascinating and fun and really inspirational. So I'd just like to give a quick shout out to Groundswell and the officers who were involved with that. The next is sort of similar. We've talked about businesses in this meeting. I'm pleased to report that over the summer, the Chair of Policy has given a positive nod, indication, wink, whatever the phrase is, to allocation of funding for a community event. And if members of the subcommittee recall, at the last meeting, the Ministry of Housing, Communities and Local Government kind of responded well to the idea that we as a corporation could act as a bit of a convener of an event. So that's been given the green light. There is a meeting later this month, I think, to explore that with key officers and members. So we'll be looking at those ideas of kind of bringing a community together here. Third is my question, which is a very wise member of this committee who leads CNCS reminded us a couple of meetings back that the Finance Committee chairman, whilst not giving a promise in full council, indicated that if the council took a decision for fundraising purposes, his hope would be that that would enable an uplift in allocation of resources to the work that we provide in service terms. I think that has gone to Finance Committee and Finance Committee has responded. Town Clerk, are you able to brief us?
Yes, I think members who were at the recent CCS committee will be aware of this, but the resolution that was passed by the Community and Children's Services Committee went to Finance Committee back in July, and the resolution for the Finance Committee is as follows, which is the Finance Committee supported the settlement in the resolution and issued its fulsome support for the corporation's efforts in tackling homelessness. Nevertheless, members were minded not to support ring fencing / hypothecation at this stage and suggested that the chairman meet with the chairman of Community and Children's Services Committee on these matters and report back.
Marvellous. Noting that said chairman is in the room, could I just maybe float something in loose terms, which the subcommittee could either sort of throw away, leave for CNCS, or kind of move with, I suppose. Could we respond basically noting that we fully support the Finances Committee in recognising that they cannot hypothecate funds, but we would like them to find some funding if possible. So bat it back, basically. Chair, any thoughts?
I think we should, yes. I mean, I think as I understand it, the corporation is right in the middle of its budget setting process at the moment, and I'm aware that each directorate is being called and being part of, is it Star Chamber? It's called the Star Chamber process. So I think now is exactly the time, if we want to make a pitch or support, then this should be it. And I mean, we've had an external report today which gives us at least 4 areas where I think additional funding is likely to be needed. We could make a case around those areas that are independently, if you like, presented to us.
Great. So those 4 areas that came up in item 4 and under the evaluation as kind of areas we could prioritise, give us a kind of a point of focus. We as a subcommittee can't really create a resolution, but would members of the subcommittee be minded to ask the chair of CNCS and her deputy to consider in liaison with Chair of Finance a proposition? David.
I was just wondering, perhaps we and officers can go something more concrete. I mean, they've said they wouldn't like to speculate. That's absolutely fine. Perhaps we can find out what the revenue generated by the increase in tax is, and then put together a spending proposal in that amount, meeting our priorities.
I mean, it's interesting because I am aware of the Chair of Finance's view on hypothecation. I mean, he makes no bones about it. He supports that approach, but it's not city policy. Except that there is an element of the business rate that is hypothecated to the police board. We know that already happens. I mean, it's in a sense, it's raising money very publicly with businesses who are willing to see that increase and it go to police. So I think there is, I don't know whether they would accept it as a precedent, but there is an approach that already exists. And I'm looking at Deborah, I think that is the case, isn't it? It does go straight to police. And it's around community safety. What more is this subject about? In community safety, we've heard from Phil today and from Will, we know what the issues are. So I think there is an argument that can be put without calling it hypothecation.
Great, and as David suggests, there should be a possibility of calculating the amount raised from that.
Well, we know what that increase for that goes to the police, so it would be in the Court of Common Council finance papers. I can't remember if it was March or April, but that's when it was discussed, I think, wasn't it, when the budget was approved, and that was explicit. And Kate can give us the...
Right, so I'm just trying to work out how we frame this, because I'm not dealing with the cold that Phil is, but I'm perhaps not at the most mentally acute. So we as a subcommittee essentially would like to push back on the response from Finance Committee. As we've suggested, there is something of a precedent that's been established, but it might not be a precedent that we can necessarily grab a hold of in terms of that hypothecation. But nonetheless, we can say it should be possible to calculate the amount that the second homes levy is raised and allocate, or rather make a bid for a certain amount of funding that relates to that. Town Clerk, can you guide us on process, or Will, or someone wise on this side of the room? Because I think we have an outcome we would like, but I'm not sure how we frame it or move it forward procedurally.
Add a sort of nuance to that. The other thing is, I don't want us to bid for something we were going to get anyway. So if Will, you're of the view that actually there would have been an increase in funding in this round coming to us anyway, what we really want to achieve is it being in addition to that. What we don't want is to give an opportunity for finance to say the increase because of this tax has been £100,000. We're going to increase your budget by £100,000 when actually we would have needed that or have received that in any event. So we need to be a bit careful around that as well. Yes, what you think is realistic.
Because as Helen's already indicated, there are 4 sort of priority areas that we could be looking to fund anyway. Will offer.
Just before you start, I mean, every year we're into the national annual grants process, and every year at this time of year, we're always officers advise us very correctly that we don't know until the grant conclusion is announced, and that would be post budget.
I think we should allow for the possibility. Yeah, definitely.
Yeah. So. But we've no, as I understand it, there's no indication at the moment that our grant is going to be reduced at all.
I've been given no indication of that. I think it's more a case of how the grant is distributed.
Yeah. Okay. So I think that what we're asking finance for, through whichever process Kate recommends, is for something that's above. It's not the grant. The grant is spent already. Whatever comes, it's already spent on things we're already doing. What we know is the increase in numbers means that we have got more to do again. And that's, I think, the argument that I probably try and frame to finance.
Right. So would it be possible to sort of say that this subcommittee would like to ask the chair of CNCS and deputy to liaise with the finance chair on the basis of receiving the resolution, noting it with appreciation, but noting that we've recently gone through an evaluation which has identified areas we could improve, and requesting additional funding to ensure that we can take one or more of those forward, because there is demand and there isn't yet, as far as we can see, allocated resource. And saying that in a more pithy, eloquent and punchy way than I've managed. But would that be possible, Town Clerk and subcommittee, if you're so minded?
I was just going to say to members that the resolution from Finance does have a commitment for that chairs of Finance and CCS do meet. I don't know, looking over at chairs.
I mean, I think what this conversation does is give me some useful information, and this conversation being minuted clearly sets out the sentiments of the homelessness.
Yes, because otherwise
and we know that CCS will be absolutely supportive of that approach. So yeah,
because otherwise it will be seen as 2 members with authority and with roles, but it's still not having the weight of a subcommittee or a committee essentially sort of asking for something. Will, you?
If I can just add one thing, and forgive me, this might be obvious, but obviously there's the budget envelope I have from City Fund, and then we become used to quite significant levels of grant funding, which has uncertainty, and we must assume, because it's the prudent way of planning, that it will end someday. So what we try to fund from within my budget envelope is what we would consider essential, that we could not do without. So if we find ourselves in a position where funding changes significantly or ends, as we speculated around when the when the rough sleeping initiative grant funding was announced very late last year, we were able to give assurances and articulate clearly what services would not be under threat. So the more funding that is funded from the core budget, the less is under threat. And I think that's important to keep in mind.
Great, thank you. So how do we treat this then? I am having a sort of a Wednesday afternoon.
Mark, what is it you're looking for? Are you looking for a resolution from this committee, or are you looking to give me a brief to take to the meeting? Are you posing specific questions?
Well, I'm not entirely sure, but to be perfectly frank, the deputy chair has reminded me we're in public session, so I'm going to try and choose my words carefully. But at the risk of being a cynic, I've been around this place 12 years, and much as I love the corporation culture and capabilities, I have seen instances where resolutions are sent, politely nodded back, and things just get lost. And I have also seen situations where chairs of committees are quite rightly reminded that they have no authority without a committee stamp on something. So what I'm trying to achieve is the recommendations of the evaluation, as you highlighted, David's point that we should be able to calculate that there's an uplift in funding into the corporation and grab some of that funding towards those aims, but ensure it's got the stamp of a committee, CNCS or this.
So given that Kate's reminded us that the comment back was for the two chairs to meet, then I will take my instructions, if you like, my brief from this committee to a meeting with the chair of finance and then report back here.
Great. And then if there's some way it either goes through CNCS or delegated authority or whatever, but if we can just find some way of getting good results from that, because I feel finance committee fobbed us off essentially, and I'd like not to accept that. Right. Well, you've all gone through this wise process of guidance, so thank you for leading my confusion towards a better place. Deborah, do you have anything you'd want to add here about the policing committee?
Just following up really a point I think that Helen made earlier. The police board has sort of restructured its subcommittees now, and we have a local policing committee. And I think it would be helpful for the local policing committee to start to consider issues around rough sleeping and homelessness on its agenda. So I will suggest that when we next meet. I can't even remember if we've got meeting tomorrow or not. But I think it would be good for the police to have at their committee meetings to have even at least one of these reports that we've had today. So I'll take that forward if you're content with that.
It seems like a great idea. Thank you, Deborah. All right. In that case, I can see nodding heads. And we'll move on, Town Clerk, to item 12.
Thank you, Chair. So item 12, we have the exclusion of the public. So I'm going to ask, are members content to exclude the public from the remaining items of business at this juncture?
So you content? Yes, nodding heads.
Thank you, committee. There'll be a short pause whilst the live stream is just ended, and I'll let you know when we can proceed.